when you open the door for somebody else.
Welcome back to the Vaccine Conversation with Melissa and Dr. Bob in our official last episode in this studio.
Yes.
This is like a part 2 to kind of what we started on our last episode, but it's sort of a new episode, but it's kind of a part 2. We sort of just got going and started talking, and so now
Melissa got going and kept talking.
I don't know what you're talking about, but I do know that I sent a message to Dr. Bob a couple days ago. Let's do an episode. It was on the way back from the last podcast, actually. We had just recorded, and I was like, you know what? We need to do an episode that's all about addressing a medical professional. Addressing somebody in healthcare, addressing somebody who has maybe worked in public health, maybe they're an MD, maybe they're a nurse, they are, like I said before, a biology major, somebody who has a very traditional sense of what the vaccine program is, how infectious disease works, et cetera. And the reason I think this episode's important is because I know a lot of you that are listening have family members or friends in the medical field who you feel like it's almost impossible to start a conversation with. I know you have family members in the
wow.
medical field
Do I ever?
that have a difficult time having this conversation because it's so indoctrinated in some people, in most people, that it's kind of like, where do I start? Where do I go? And so I thought to myself, well, if I was talking to somebody who is a medical doctor and we happen to be sitting on a plane next to each other, what would I say to him or her? What would I say to that medical doctor to open up their eyes and to maybe have a little more understanding on this issue from our side? What types of studies, what pieces of information, what direction would I go in? Because it's a different conversation that you'd have with somebody that's a medical doctor versus somebody who is your neighbor. And, you know, I always joke around, like, we can't get into this whole, like, you show me your study, I'll show you mine. And I think that's what happened to you with your family member via email. This idea of having a study off, I'm going to show you my study and you show me yours. I want people to know that on the mainstream side of this, there are going to be a ton of studies because we know they're funded to come out with a certain, output. So they're going to have those studies. So you might not be able to keep going back and forth. That doesn't mean that our side is invalid in what we're saying. And there aren't going to be as many studies on our side. There aren't. Because coming to those conclusions is not desirable for the medical establishment. So what would you say to somebody in the medical field? Dr. Bob, you each have your things. I have my things. A couple of questions I would ask. And I think I would probably start with questions. And maybe I'll start with mine because they're a little less heady than yours are probably going to be. Yours are going to be a little more, rooted in science and medicine, which is good. And you want to be able to approach that from a medical doctor's perspective. You want to say, what would you as a medical doctor say to another medical doctor that maybe doesn't believe in the vaccine hesitant movement? They don't believe in the medical freedom movement. They think that we're all anti-vaxxers and we're all dangerous, et cetera, et cetera. So a couple of the things I jotted down of the questions that I would ask. I'm always worried when my phone doesn't recognize my face. Like, how tired must I look?
Sometimes I haven't recognized your face. Like,
not
like
nice.
I'll be here in the studio and then some woman will walk in and
That's
hair
not
is
nice.
out of
I
place,
know, it's
and then just
I don't always put it together, people. Okay, I apologize to our in-studio guests for not looking my best, but this is the best I could do today. So, okay, here are the questions I would ask. If I'm sitting on a plane next to a person in medicine, I would say, probably from the beginning, do you think all the parents that are claiming that their children had vaccine injuries, do you think all of them could be getting it wrong? Do you think it's possible for tens of thousands and hundreds of thousands of people across the globe to all be making the wrong conclusion? Are they all just coincidentally pinning it on something that it's not connected to? Are they all just so uneducated that they're, throwing darts at something, hoping to catch something? Could they all be having the same story coincidentally, but it all be wrong? And this is, again, a very ideological question. Is that possible?
Yeah, well, I think the mainstream medical professional would actually say, yes, they are all getting it wrong. I mean, in their brain, they really, truly believe that.
So we're talking about parents who are also doctors or medical professionals, lawyers, extremely intelligent business people, people with secondary degrees. We're not talking about lower level Americans here. We're talking about upper level, highly educated parents. Do you, the medical professional, still think all those people, they happen to be so intelligent everywhere else, but in this one area, they're just missing the mark? And how could all of them be in the same boat?
Well, so I think the challenge is obviously we don't think all those, parents are wrong. And so the challenge is, how do you get the medical professional with a certain mindset that really does think they're all wrong? How do you get past that first little hurdle and try to make that medical professional stop and think something different than just the straightforward dogma
Right.
and almost, religious like belief that they have? How do you get over that tiny little first hurdle to make them say, that's interesting. Maybe I should sort of kind of re-examine that. I mean, I think you sort of hit it on the head a little bit, is pointing out the fact that vaccine hesitant parents are more educated, that they tend to make more money, have a higher level of education, and maybe get them to try to wonder why does that subset of parents, why are they the ones that are vaccine hesitant? And to me, kind of the way around that is you need to tell that medical professional what you are reading, that you're not just reading Google. You're not just getting educated off the internet. You didn't just see one person kind of give a lecture about vaccines and you were sold. You need to tell the medical professional, hey, I've read through dozens of articles from the British Medical Journal. They publish a lot of interesting things about this. The New England Journal of Medicine, the Journal of the American Medical Association, the Journal of the American Academy of Pediatrics. Every single one of those journals has two types of research. One type of research that says, in general, vaccines are safe and there's no concrete evidence that they are related to any of these chronic severe problems. That's one type of research. But the other type of research that they're publishing over and over again are case studies of severe reactions, or like groups of patients who have had severe reactions. Here's a study from the American Academy of Pediatrics Journal from 1998 that shows how many people suffered severe brain damage from the MMR vaccine. It's right there in the AAP journal. And so I think the way you get over that hurdle is to get the medical professional to at least acknowledge that you as an individual are reading these studies in the same journals he or she is reading, and the studies are there. They're there over and over again. Yeah, the conclusion in these journals is that we can't prove the vaccines are related, but we're going to still keep reporting all these case studies. And if you can, if you want to be prepared for this, if you have maybe the 10 best such research studies from all these mainstream journals, and you say Dr. Smith, I believe what I believe, not because I saw Jenny McCarthy appear on an interview somewhere and talking about what happened to her son. I believe what I believe because all of your medical journals are reporting on these reactions, and so you tell me what you think about that. So I think you've gotten over that first hurdle to get that doctor to at least maybe look at you a little differently, saying, oh, that's interesting. So you're not just a crazy person that has these beliefs from someone else. You actually got your belief after reading the same medical journals that I'm reading. So maybe that sort of bridges the gap or opens the door a little bit for the conversation to continue a little bit further, in my opinion. I think that's how a doctor would look at it.
But even before that, because obviously if I jumped in the first line, somebody I'm sitting next to on an airplane, like I've read and then listed off 10 different journals. To me, that's even still...
Well, sorry, it's not like my study versus your study.
No, I know.
This is the foundation of where I'm getting my knowledge.
Right.
But I'm acknowledging that the same journals say overall there's no proof that vaccines are the cause of this. yet those same journals keep reporting these problems, potential problems over and over again. So that should lead us both as medical professionals to further investigation, not just to be able to, shut this down and say, case is closed, as you've said in another interview. I think, because you're right, you can't play my study versus your study. You have to,
but I'm
you have to
wondering,
present yourself as an intelligent person and where you're getting your research.
Right. But I'm saying even before any of that, even before all that, you're having this conversation you just started, and you are an intelligent person. Of course, you want to make sure that you portray yourself intelligently and you are articulate in the way that you speak about all things, because you can tell usually like a level of intelligence by somebody, whether they're talking about the weather or they're talking about how full the airplane is. You can tell by the way somebody speaks how intelligent they are before they're listing the journals that they look, for vaccine safety studies. If I say to somebody next to me who's a medical doctor and I start to talk about what I've witnessed in my child, what I saw happen in my child, and I'm saying it in a way that's articulate, I'm saying it in a way that's rational, it's logical, it's intelligent. And then they know that I come from an academic background. They know that if I was a lawyer or another medical professional, you would respect that person in a way to know that you can deduce information at that level of intelligence. So there's no real chance that you're so smart over here, but you just happen to witness something in your child that's non-existent. And you just happen to make this up. I think part of understanding that why there's a huge portion of our movement are made up of very intelligent people. The reason for that to me is not so much about the studies, but it's about normal reasoning, normal deduction, just being able to have a rational conversation based on data that you have seen. You have seen it and you make logical conclusions.
Right.
That's what intelligent people can do.
Right.
It's not reasonable that hundreds of thousands of intelligent people would just coincidentally not be able to deduce in this one situation, but they can make really good. You know what? You understand what I'm saying? So understanding the intelligence level, but not even so much about, well, look, I read these journals, more just, I've made it pretty well in my life by being an intelligent person. I know how to look at data and understand when it is and isn't accurate. I'm not just throwing something out here. I mean, maybe one or two of these cases isn't connected, but you can't say that about 10,000, 50,000, 100,000 people. And these are people who make a living on their intelligence.
Right.
They actually make a living because of their higher level of education and their ability to deduce information and make accurate conclusions. You can't do that in a courtroom, but somehow missed it when you're at home watching your kid after their vaccine appointment. You see what I'm saying?
Right.
That to me is an ideological conversation to have with, is it possible that all of these parents are getting it wrong? If you really dive into that question, I don't know how somebody who's also intelligent and rational and logical could say, statistically speaking, it's possible that every single one of these people just got it wrong.
Well, actually, I think then the regular doctor would believe that 100,000 parents could be getting it wrong. I feel like they do believe that many parents are capable of being delusional on this,
even if they're so smart everywhere else.
Right,
the top attorney in their field, but they're delusional here.
I think I like how you're presenting it. I think that's a good point. But they're thinking, well, most of the people in that movement aren't that intelligent lawyer or that well-educated person.
But that's the point. The point is to bring that to the forefront.
Right. But so for me, you're not going to get that doctor to meet you there just on the fact that there's 100,000 super intelligent parents that believe this. I think that might help them in the long run if they realize, hey, all these parents, they are all more educated and maybe I should start listening. But I think you have to figure out how to get them there. And for me, one useful technique would be when you're talking to a doctor is try to find common ground first. And for me, some of the common ground statements that maybe you and the doctor would both agree on in this would be things like, well, yes, Dr. Smith, I agree that vaccines do work. Yeah, and then if you're gonna have a 2-hour conversation, you could eventually get to where how vaccines work in a variety of different ways, and some work well, some don't work well, and some barely work at all. But so you can eventually get there. But you could agree, well, yeah, vaccines do work. I'm not saying they don't work. I'm saying my child had a severe reaction. But you want to find this common ground. Vaccines work. Well, yes, really severe, life-altering, severely disabling reactions might be very uncommon. That the number of people that happens to is maybe that is uncommon. Yes, most people seem to handle vaccines well. Yes, vaccines have helped reduce some diseases. Those are sort of, to me, those are statements that doctor, if you're at least agreeing to those sort of basic tenets, at least on some level, that pulls them into the conversation a little bit better, because you're not arguing those points. You're arguing like the finer, like the deeper levels of those points. So you're arguing what happened to your child, and you're arguing that 100,000 other intelligent parents are saying the same thing. But I think if you can use that common ground tactic, to me, that is something that a doctor would listen to. So even though it's unfortunate that they need that to see you as an intelligent person, but if they hear you kind of agreeing to that common ground, then they're like, okay, this person is intelligent. Maybe I'll continue this conversation. Well, it's unfortunate it has to be that way, but I think that's probably the reality.
I mean, we've said this before, but before any conversation that you have with anyone, you also need to think about your intention for the conversation. What do you want that person to come out with? Am I trying to have a conversation with a medical doctor next to me so that I can get them to scream from the rooftops that vaccine injury is happening and this is a big conspiracy? No, of course that's not what's going to happen. And I think because medical doctors or medical professionals have a very generalized, stereotypical view of who we are on the other side of it, I think my primary goal would be at the end of that conversation for them to have a different view of who we are. Because they might say, you know what? Maybe there are a few crazy ones, but I was sitting next to a girl on the plane the other day. We had an hour-long conversation. She seemed really intelligent. She was rational. Her concerns seemed valid. She wasn't trying to destroy the entire vaccine program. She didn't think that was what was necessary for us to move forward. I think your intention is important. And if your intention is to maybe point out that mandates are unethical, and maybe that's what you want to get to. So yes, I agree that vaccines have reduced the incidence of disease for certain diseases. Yes, I agree that there are some of them that have less reactions than others. Yes, I agree that some people don't have noticeable side effects after getting many doses of vaccines. Yes, I can agree with those things. However, we do know that all pharmaceutical products have side effects for some. We do know that there are children that are negatively affected by this. Because we know that, how is it ethical for us to mandate when those are the kids that are being discriminated against and being kicked out of school?
But I think the way you get that doctor to meet you there, whereas yes, some children are negatively affected. In the doctor's mind, he or she is thinking, well, no, they're not. Vaccines are perfectly safe. In their mind, they're thinking, wait, you just said some children are very negatively affected. But in my mind, I've always thought vaccines are perfectly safe. So what do you mean by that? And I like how you said, some pharmaceuticals or all pharmaceuticals are going to have negative consequences for some.
That's right.
So I like to bring that up a little bit further, like with a medical professional. And I like to kind of portray kind of like what their experience is like as a doctor every day. Like they're writing antibiotics, okay? They're writing antacids for kids with reflux. They're writing, steroids for, kids with asthma
Lots
attacks.
of medical interventions,
Right. And in their mind, and especially like the classic example for pediatricians would be if you have a kid who's taking Tylenol all the time for pain relief, you have to worry about liver failure. And you have to worry about, antibiotic allergic reactions. You have to worry about steroids lowering your immune system a little bit. So doctors always have that in your mind. And so I think, to me, if I was a doctor like on their side, it would speak to me if a person who is intelligent like you and we're having this conversation, you want to get me to include vaccines in that category of medications that can have negative consequences.
For some. We're not saying it for everyone.
So you want to you just want to give some examples of things that they're commonly using all the time. Like say you're talking to a neurologist and you're talking about, seizure medications. They're great. They help, reduce seizures in kids, but you're always monitoring for severe reactions. Some seizure medicines can cause severe liver problems, and you're always, watching that and worried in the back of your mind. Well, the same thing is with the vaccinations as a pharmaceutical product. It's gonna have a negative effect in a small number of kids. And to me, that would really speak to a pediatrician or any doctor if you can kind of get them to see it as a pharmaceutical.
Yes, exactly.
Is which you keep saying.
right.
But you have to kind of, how do you get them to see it as a pharmaceutical? And you get them to see it by pointing out other examples of daily pharmaceuticals they use. But then you say, and for every child, every 2-month-old baby you're seeing in the office, you're giving them 3 or 4 injections that have, about, 8 or 9 vaccines, in them total. You're doing that, 2 months and 4 months and 6 months. Well, that's way more kind of invasive and, influences the immune system in a much stronger way than any of these other medications. Like say you had to give them an antibiotic, say you had to give them an antacid. Comparatively, the medical influence of that many vaccines on a baby is on a potentially higher level than that little course of medication you're going to do. So shouldn't you as a doctor kind of consider that or factor that in to something that could negatively influence a small number of babies in that scenario? And at least kind of recognize that. Is that possible? And is that true as a pharmaceutical product?
Well, I think that angle, is that possible? And in line with the pharmaceutical companies, I would also maybe bring up, have pharmaceutical companies ever before in the past lied about safety data for their medicine? Have they ever been federally tried for misleading the public, falsifying data, or hiding information from the FDA or the public? Like, has there ever been a circumstance where the pharmaceutical companies were not completely transparent? They were not honest with the public. They were not honest with the medical professionals who were even using their products and giving them out. If we know it's happened before, and we know it's happened multiple times with every major pharmaceutical company that also happens to be a manufacturer of childhood vaccines, why would we not assume there's a possibility at least that it could be happening with vaccines as well? As in can we agree to that? Yeah. Can we agree on that?
Yeah, well, you got to be careful because they'll agree with you on medications, but the automatic knee-jerk response is, no way is that possible when it comes to vaccines.
So I'd probably ask, why not? So I'd ask, why not?
Right.
I put it back on them. Explain to me why a product that is manufactured by a pharmaceutical company, just like every one of their other drugs, is somehow completely void of any type of safety risk or whatever. Explain to me why that's true. And they might say, well, these are biologics, right? It's in a different category.
Right. And I like the biologics part of the conversations. I think a conversation with any medical professional should include the issue of them being classified as biologics and medications being classified as pharmaceuticals.
Drugs, yeah.
In no way whatsoever does that change the safety profile or make vaccines somehow automatically safer simply because they're classified as biologics. What that doctor probably doesn't know, and where this conversation needs to steer toward, is the fact that biologics are not required by the FDA to have placebo safety testing.
Right.
You need to tell that doctor that. So you sort of need to acknowledge, in your mind, I understand that you view vaccines as incredibly safe, way safer than medications. There can't possibly be something wrong with them where they're causing any negative consequences, except maybe in the extremely rare cases. I understand all that. But let's explore why you think that and how the FDA approaches this. So you have all these medications that every pharmaceutical company is mandated by law to put through placebo safety testing using inert controls and do randomized controlled trials on people with the medication, without the medication, and people with a current level of treatment versus this new level of treatment. They have to go through all that safety profile because that's a pharmaceutical, that's a medication. They're required to do that.
So why are vaccines listed as biologics then?
Right. So vaccines are listed as biologics because I think it's because anything that's a blood product, anything that's like a blood product or is injected as a way to like influence the immune system in a certain way. They're all in this totally separate category. And honestly,
Which
I don't.
seems like it should have more restrictions.
No, you know what? You're
theory.
you're right, and that might speak to the doctor. Yeah, but I think you need to make sure the doctor realizes that all this faith he has in pharmaceutical safety research, and pharmaceutical safety research is actually way more extensive because they have to do placebos. And in that category, they fully acknowledge there are severe reactions.
Right. And then
So
there's
then-
lying about safety data and all that stuff.
Right, yeah.
Under those categories
Yeah.
also.
So you hear about Vioxx, you hear about these other things where they actually have been found, criminally negligent in the safety data. So then now we have vaccines. They don't have to do any inert placebo safety testing. Now the doctor won't believe you, so you have to show that to them. But you can at least maybe get them thinking, aha, this whole category of medical treatment has no placebo safety testing. It's a whole different category. And then, we've never, tested, any of these kids who are not getting vaccines compared to the kids that are getting the vaccines. That's the whole hallmark of classic, mainstream medical research. The whole time in their mind, they're thinking, well, that's okay. Vaccines are perfectly safe. But I think so I don't think you're going to convince them that there's anything wrong with that system in this conversation. But I think the value will be is they'll understand why you as an intelligent person believe the way you do, because
Right.
you have discovered that because vaccines are in a different category, they're allowed to be, approved without placebo safety testing, without any long-term outcomes research in kids who, get vaccinated compared to kids who don't. They're allowed that, and you as a consumer are uncomfortable with that. You as this doctor's patient are uncomfortable with subjecting your child to this invasive set of medical procedures that didn't go through the same safety testing as all other pharmaceutical products. And I think they won't look at you crazy for that. I think they'll get that.
At least it seems reasonable.
Right. It seems totally reasonable. And as you say, that's part of your goal.
That's part of the goal.
They want you to seem like a reasonable person.
Right. I think I would probably follow that up with then maybe asking about ingredients in vaccines, about whether or not they know of all of the ingredients. Could they name several of them? And specifically getting into discussion on aluminum. There is no medical professional out there that has done any current research that can say, based on data that's out there, that injected aluminum is completely safe. And we're not talking about just about vaccines, but just in general, because there is so much data that shows the Alzheimer's patients and things like that we know aluminum is neurotoxic. That's kind of like something most people agree upon.
Yeah.
For whatever reason, they seem to think that you ingest, the ingest versus inject argument that we talked about before as well. They tend to think it's an okay amount though.
Yeah.
And I think if maybe that conversation got into a little bit for this dose times multiple doses times a 2 months, 4 months, 6 month appointment, then 12 months, then 15 months, then 18 months, and now every year after that. Once you get to that cumulative load of aluminum, and there is no way out for some of the aluminum that gets stored, which is proven through peer-reviewed medical literature, like Christopher Exley and Chris Shaw. When you know there's data that says aluminum is getting stored in brain tissue and in the organs, and when it's injected, there's really no way for it to get out of the body the same way that it's ingested. Even being able to say that to a medical professional, again, you are going to at least appear reasonable, because you're not just, this is the way I feel, it's my body, I don't want the government telling me what to do. And that's kind of what they tend to think of our side, as that we don't have any science or data to back up our argument.
Right.
Again, my goal is not to convince the medical professional to believe what I believe. My goal is to convince that medical professional that I have a valid reason to believe what I believe.
Yeah.
And that comes down to this intention.
Totally.
I think our side keeps missing the mark on that, because they want to teach somebody. They want to convince them,
Right.
and that's not what our job is. Our job is to tell your story in telling your story, you also want to change this narrative about who we are as a movement. And again, if that doctor or that nurse or that biology professor gets off of that plane with a different view of somebody on our side, then I have succeeded.
Yeah, totally.
Because I do come from an academic and intellectual background. I'm not going to just make things up and just come to some viewpoint for nothing. There's obviously a reason I have come so strongly on my opinions on this outside of just my personal story. I've done a ton of research as a result of my personal story. And if I can let somebody understand, we're not all who you think we are. And I've had that conversation multiple times. I can't tell you, just recently, being on an airplane and just being able to say, I know you probably think we are this way. I know you've probably been told X, Y, and Z. But what you'd be surprised to know is that most people in this movement are parents like me that are educated, intellectual people who had firsthand experience of side effects, negative adverse reactions, and who at that point had to go into deep research mode to really understand what had happened to their own kid and what to do in the future now as a result. I think if you go into a conversation trying to convince that medical professional, then it's going to be a my ego versus your ego. And it becomes a battle and it never wins. Nobody wins. It's the same thing like the super pro-vax troll guy who's like online that people are going back and forth with. Here's a study on this and here's a study. It's like, you're not going to win those conversations. And that shouldn't even be the goal. The goal is not to win. It's not to stump them. It's not like, let me stump you. The goal is to say, okay, but what about this? So then we talk about ingredients in aluminum.
Right.
I can't imagine any medical professional really feeling like, no, I'm totally fine with aluminum. I'm not worried about that at all. I don't think there's any risk to that. There could be some, but some of them have at least pondered a little bit about aluminum.
Right.
And then I would also go into the federal vaccine court and an idea that there has been so much money paid out. Do you think the federal government is paying out for injuries that aren't really happening? Do you think, considering the burden of proof is so high and it's on the parent, do you think it's really possible that $4 billion could have been given out all for injuries that really weren't connected, but they just wanted to keep somebody happy? Like, do you think that's actually possible?
Yeah, well, that's a great place to go because that's concrete. They can think about that, and you want to sort of have the numbers at your fingertips. Is it about 4,000 people have won their case in vaccine court or been awarded or settled, something like that? I don't think it's 4,000, but yeah, it's over 4 billion.
But that's just who's won.
Right.
We know that it's really hard to win in that court, again, because of the burden of proof. We know that their goal is to try to make sure you don't win. So if they're settling for these kind of numbers.
Yeah, but a doctor's only going to think that the ones who won are the ones that are semi-legitimate. So I think and I bet most doctors don't even know about that vaccine court or know what the numbers are, know how many people have been through it and how many people have been awarded. So I think, again, I should have these numbers at my fingertips, and even I forget the numbers sometimes. But that's, I think, a way to demonstrate to that medical professional that if our government is legitimately awarding thousands of people after they've had a proven vaccine injury, doesn't that at least then make it plausible that these vaccine injuries are happening? And so, when they happen,
plausible.
Right. So, and because me as a mom, here's the numbers, right? Yeah. So it's 6,000, over 6,000, injury and death claims compensated. All right. Mostly through negotiated settlements. All right. Over $4 billion. Paid out. So have those kinds of numbers, that medical professional might think, gosh, 6,000 victims of severe vaccine injury, that's way more than I would have even thought possible.
And that's severe.
Right. And so that at least gets a concrete number into their minds. So then you follow it up with, you're thinking, okay, me as an intelligent parent, I have a child, I have an uncle who was in vaccine court, or my neighbor I met down the street, they were in vaccine court, or I have a friend, my kid's friend at school, their kid was one of those 6,000 people. When I hear that sort of thing happening, that scares me and that concerns me, and I worry about putting my kid at risk of that kind of injury. don't you think at least as a parent, I have the right to actually consider that or weigh that into this risk benefit ratio when we know those injuries are, are legitimately happening?
And I think so for my particular story, because the injuries to Serenity were moderate, right? And obviously could have been so much worse had we done the full amount of doses every single time. God forbid, like who knows what that would have happened. We know what would have happened. And had we not stopped at 12 months, had she kept going, I would personally also bring up seizures. And I would do that because that's something medical professionals tend to think are harmless.
Right.
And because they're so common, they've been very normalized. The CDC mentions that. We talk about the MMR and chickenpox given together and the 1 in 1250 or whatever it is. And then a 1 in 3,000 risk for every just individual MMR vaccine that's given. The CDC talks about febrile seizures, but of course there are different types of seizures that happen as a result of vaccination. Recently, we covered the idea of febrile seizures and whether or not they really are harmless, because new data now is coming out that is actually talking about how the early febrile seizure can turn into chronic disease later on. It can turn into epilepsy, and it can also turn into mood and personality disorders that become a lifelong debilitating condition for people as they turn into teen and adult years. And so I would love to have that conversation with a medical professional who says febrile seizures are harmless, because I will talk about my own experience as a child having that happen, being put on anti-seizure medication till I was 5. And at that point, you're supposed to outgrow them. But for some children, they don't outgrow them. The more frequently they have the febrile seizures combined with other things like being fully vaccinated, lots of antibiotics, et cetera, can turn into an epileptic condition. And new research showing they're not completely harmless after all, and they're so common, is there a reason to have concern? And I would absolutely bring up family medical history to a medical professional,
right.
because I think that's something to consider. As a medical professional, when it comes down to you asking about a medical intervention, it is your due diligence to ask about family medical history. I was never asked about that with the pediatrician before vaccine appointments for my daughter. I should have been, because the family medical history paints a picture of whether or not that patient is a good patient to be receiving that particular intervention or not. I think all medical professionals can understand there is genetic susceptibility. There are certain people that are at risk over others. There aren't really ways to tell necessarily, but because we know there is such thing as a complex medical history with your family and how genetics play a role, that's a conversation I think that would instantly also make you reasonable in your argument. When you're talking about, you know how everybody responds differently to every medication. Some people that you write a prescription for blood pressure medication could be totally fine with this one. Some people have side effects. Everybody's unique. The same is true for vaccines. We have this one-size-fits-all approach. We're universally giving out a schedule that we don't necessarily know how that child's body will react. Some children will react poorly, just like every other pharmaceutical product. It's reasonable to understand genetic susceptibility is something we should have as a part of the conversation. It's reasonable to be curious about how the body responds to certain components, certain immune activation events. I mean, if you're throwing some of this in there, what kind of person could sit there and go, no, you're totally off. Like, you obviously have nothing to go off of.
Right.
There's a lot here to strengthen your foundation of, this is why I came to my belief system.
Right. Well, I think that's key, because personally, I don't think a doctor is going to think family history matters, like on the surface level. So you have to present it the way you just presented it, as, because they're not going to think like, any sort of family history is a valid reason as to why you can't vaccinate your child. So I think you have to present it as what you're thinking and your thought process. And so, something that is personal to you and that applied to your kids does matter. So I think you want to find, someone who's in this movement, if you're going to be having these conversations, you, I think, want to establish in your mind, what are the family history factors that you think really do fit well and are good criteria as a family history factor in this discussion. You can't just say, oh, everyone has autoimmune disease, so I'm not going to get vaccines. I think that you want to have it more concrete, just so that you are shown that you're thinking through it. And what you really want to remind this doctor is, family history is everything in most medical fields.
Right.
And so you can remind that doctor that, I know in medical school, you guys learn how to do physical exams and take histories, and taking a family history is like paramount. And in every new patient,
Right.
you want to know
Cancers and heart disease
exactly.
and those things that are passed.
Because you want to know what risks, your patient has based on what their family. So here's what happened to my sister's kid the day they got their 1-year-old vaccines. They got the pneumococcal and the flu shot and the MMR vaccine, and boom, had a febrile seizure, and now their child has ongoing epilepsy. So now that it's been well established in research that those three vaccines are connected, do have a causal connection to seizures. Considering family history, all I'm saying is, I'm not saying like this means I for sure shouldn't vaccinate, but what I'm saying is I'm factoring that in as an intelligent, educated person. I need to factor that in as a family history issue as I weigh the benefits versus risks. Again, it's showing that you're thinking through this on an intelligent way, because you want that doctor to leave that airplane flight thinking, that smart woman that I spent the hour talking to, she seemed like she really was thinking through this.
So we're going to wrap up this episode now for part 1 of how to talk to a medical professional. And we'll come back with part 2 where we can go into more detail of the kind of questions you would ask, the studies you would bring up, and the conversation you would have with someone who works in medicine as it relates to vaccine hesitant parents and our movement for medical freedom. So thanks for listening, guys, and we'll catch you next time on the Vaccine Conversation.
We're gonna be the peace we wanna see in the world. Yeah, be the peace we wanna see in the world. Be the love we wanna see in the world. Be the joy we wanna see in the world. Be the change we wanna see in the world.
The information in this podcast is for entertainment purposes only. It is not intended as medical advice. Always consult your healthcare professional for information on vaccines and infectious diseases.